Now call upon Dr. Thayalan. He was former professor of radiological physics at the Madras Medical College and has been author of several books on radiological physics and radiation safety, and a very good friend of Christian Medical College, Vellore. He comes and gives lectures for us quite often. He's a very senior physicist. With this introduction, I request Dr. Thayalan to...
Thank you, Paul Ravindran. Good afternoon to every one of you. I am very happy to be here to deliver this talk on radiation safety on healthcare workers. So whenever we come to CMC, we adore actually the magnitude of the institution and loyalty of the people and the hospitality they provide. And they make us to come again and again and deliver some form of activity, either as students or as outside visitors like that. Let us discuss the topic, the radiation hazards, with this. I shall spend some 3 slides making this emphasize or some form of questionnaire why actually radiation safety as an issue to globally as well as actually our local scenario. If you go through the history of radiation accidents or incidents, Marie Curie, one of the Nobel laureate who discovered actually the polonium as well as the radium, died of anaplastic leukemia due to excessive exposure. The other gentleman, actually Thomas Edison, who was responsible for discovery of fluoroscopy, calcium tungstate crystal, he brought it to the world that was used for more than 100 years in radiology. His assistant, Clarence Madison Talley, died in 1903 due to overexposure of X-rays. So immediately Thomas Edison told no more X-ray. He abandoned all his research activity and shut down his laboratory like that. So all these things actually recall us and tell us there is something actually fishy in the activities or the practice we do. We have to do some more in the safety aspect. That's why the safety comes into picture. Any actually excess exposure may lead to some form of damage. Either it may be hair loss, or it may be skin erythema, or it may be a cataract, or sometimes development of cancer also. So why actually the radiation safety became an issue? The problem is the training we provide is not actually the same and uniform to throughout the healthcare professionals. Healthcare involves a lot of professionals. For example, if you take radiologists, we are giving actually very rigorous training. Cardiologists, there is no training. Technologists, we are give 100% training with the 3-year course, 2-year course and strict examination. Nurses, no training. But they are forced to work in radiation. This is the challenge. Most of the times the myth is, if you give high radiation, probably you may produce good pictures like that. This is the myth people believe. It is not so. Even actually with the low radiation dose, we can produce good images, we can produce optimal radiation, we can produce good therapeutic treatment also, that is possible. This is what actually we have to think. Now with this background, if you go through and find out, the only hazard we have is radiation. It is not so. There are multiple hazards in healthcare centers, but radiation is one of the hazards. It is in the form of X-rays. If you see here the last, X-rays are in the form of radioactive material. Who are the persons exposed? These are the personnel exposed. So several number of people are involved like that. Who are the topping the list? Probably the top list is the interventional cardiologist. So the globally now, interventional cardiology is the highest exposed persons, along with staff nurses working in cath labs or the ward boys, whatever may be. The second is interventional radiologist. The third is the nuclear medicine technologist. With the advent of PET-CT, things still goes actually in a different way. So these are the top 3 people exposed to radiation to a higher level. Of course, other people also exposed to a little bit like this. So with this actually as an introduction, now I put you what is radiation. Radiation is a form of energy. It is invisible. You cannot feel it, you cannot taste it, but what happened, it can pass from one point to another point and transfer energy. Almost it will travel like a light. 3 lakh kilometers it will travel per second. There is no obstacles beyond. There are actually 2 types of radiation. One is the particle radiation, the other that is called X and gamma radiation, photon radiation. The other one is a particle radiation. Mostly actually in medical institutions, we use actually X and gamma rays. Some extent we use electrons also. Now these radiations can be classified as ionizing, non-ionizing. What do you mean by ionizing? Radiation carrying energy, sufficient energy to remove an electron is called ionizing radiation. Probably these are the examples: X-rays, gamma rays, betas. Probably you can see in this side, this is a gamma rays and X-rays actually here in the electromagnetic spectrum of lower wavelength. There are some radiations do not have much energy to ionize. Probably that is the right side, maybe heat, light, laser, heat, microwaves, but still it can also damage tissues, but not to the magnitude of what we say ionizing radiation. How to measure the radiation? Radiation can be quantified in terms of some unit. There are some activity, you can see here. Activity is the unit. Actually, you can make it in Curie or Becquerel. Suppose radiation exposure, you can call it in Röntgen. Absorbed dose, you can make it in Gray. Effective dose, you can call it Sieverts. Probably in the Sieverts, what we do mostly, we use in radiation protection. The Gray we use in radiation therapy. Exposure we do for calibration of equipment. Becquerel purchase of radioactive material whenever we deal with the companies or actually these suppliers. Now the question is whether X and gamma rays are ionizing radiation. Yes, S and gamma rays are ionizing radiation. If they passes through the medium, it can remove electrons, and it do actually, you can, what happened, produce charged particles. Once you produce charged particles, there is a chance of radical formation. You can see the right side, H2O. Because our human body is plenty of water, once radiation is given, it gets actually splitted and OH radicals are formed, H radicals are formed. What are radicals? Radicals are actually unpaired electrons. They cannot stop from one place. They randomly move from one point to another point and deliver energy and damage further molecules and ions. That's why the biological effect comes into picture. What they do, these radicals? These radicals attack the molecule. You know, we have big macromolecule 5. We have actually a lipid, we have actually a carbohydrate, protein, and then actually this nucleic acid. So nucleic acid is most sensitive target for the radicals. Once it is damaged, it undergo mutation. Once mutation, there is a biological response. You can see here, dicentric can be formed. Chromosome can form dicentric. This is a ring formation. Radiation can actually create ring formation dicentric so that it get damaged. Sometimes what will happen, if the radiation levels are very less, it can repair itself. Then it goes, what is repair is taking place? The entire thing comes to normal after the repair. So in total, what we can do, the biological effects can be classified as somatic effect and genetic effect. Somatic effect again classified as deterministic and stochastic, or genetic effect only big stochastic. So this is the difference between the two. The right side is deterministic. You can see the threshold here. At 0 doses, no deterministic effect. If the dose is very, very less, no fear of deterministic effect. In whole hospital, in industry, in medicine or medical college, there is a less likely deterministic effect to any individuals. That you can make it very clear. You can see here the other side, stochastic effects start from 0. That means what? Even a 0 dose is not a safer dose. That's why radiation safety is issue. That's why we want actually radiation safety officer. That's why we want the training program. Even 0 dose can cause stochastic. It's something like a random. Can you count actually in Madras Mount Road how many accident takes place in one day? Nobody can predict. One day there may be 5, one day nil. So that is actually stochastic. Similarly, if 10,000 people are exposed to radiation, one may get cancer, other people may not get cancer. Even we want to bring actually the one out of the risk. That's why actually the safety concept comes into picture. Now if you analyze what are the radiations that people are using in industry, radiology and imaging, X-rays and radio frequency waves, radiotherapy, X-rays and gamma rays, nuclear medicine they use gamma rays. If you analyze the entire area, the top actually 2 is actually the fluoroscopy and CT scan. Fluoroscopy in the form of cath lab, CM is heading the radiation events, and probably CT scan. Now I have composed chest X-ray. If you take, what will happen? The skin entrance dose around 0.14. The same chest area, if you do the CT scan, probably it may give actually 13.2. If you make a ratio, it gives 94. What it means? Taking one thoracic CT equivalent to 94 chest X-rays. So if you come here, similarly if you do the chest area, if you do barium meal, interventional procedure if you do for a patient, that is equivalent to 3.6, it is equivalent to 25 test X-rays. So what it means is there, among the actually the medical industry, the fluoroscopy as well as the CT scan contribute higher amount of radiation dose to the personnel. Those who are actually involved in the room are actually working along with the radiation, though we should be very careful. Now you can see that CT scan globally only 8% application it has, but how much contribution of dose it gives? 48. Fluoroscopy only 3% application it has. Fluoroscopy means, what I mean is cath lab, all the CM used by different specialties, urologists, orthopedics, surgeons, surgical gastroenterology, everything comes under fluoroscopy. So what happened? Fluoroscopy, 30% dose it gives. So this is the matter of concern now. That's why globally people are taking a lot of initiatives to reduce, actually address these areas. Now a question comes, whether radiation is having a risk or not. Yes, we do have risk. Suppose what is the risk in traveling in a busy road? Death, accident. Not here, no death is involved. Radiation can give you a risk of development of cancer. So therefore, this what actually we call it, radiation related risk is only not death, it is actually cancer, induction of cancer. Now what is that? It is 4 into 10 power minus 2 per sievert. Suppose what is the meaning of that? If you take 10,000 people, give 1 sievert radiation to each individual, then the risk is 0.04. That means less than 1. 10,000 people, 1 sievert if you give, the risk is less than 1, 0.04. What it mean? Any industry, if the risk is less than 1, that industry is called safe industry. So radiation comes under safe industry. Because of that, events and literature comes and footnote comes in the text, these newspapers, we should not alarm ourselves. So suppose if you take airport travel, air travel, construction industries, digging actually wells in the, and then agriculture, if you see, the risk is actually more than 5 per 10,000. So a construction worker more than 5 in 10,000. So therefore, the risk is there, that is cancer. But the risk is comparable and safe, that's why radiation is a safe industry, we call it. Probably I skip these slides. Now what is actually the policy? If somebody asks you what is actually the policy for this, the policy is very simple. Prevent all deterministic effect. You initiate effort and prevent all deterministic effect. Stochastic is a random process, we cannot prevent, but we can minimize. So there is, the radiation safety policy is very, very simple. Prevent all deterministic effect, keep the dose actually as below as possible, and then minimize the stochastic effect by limiting the doses like this. That what we call it ALARA. ALARA means as low as reasonable achievable. So taking social and economic factors into account. For example, I will say, 1 lead-apron I put, I can get 90% reduction of radiation. I cannot put actually 5 lead-apron. If I put 5 lead-apron, I cannot bend. I cannot actually move my hand. Then what will happen actually? I will be spending longer time in the room, then actually it is not correct. So something like that, you can always compromise in between this, this way the radiation safety. Now this is the dose limit already covered. Now what actually everybody should do? All radiation work, we should classify the workers as radiation worker, non-radiation worker in the hospital first, irrespective of the gather and position. Once you identify them radiation worker, they should be covered under the personal monitoring. They should be given TLD badges. That's a must number 1. Now the TLD badge, we need not go to this. It can detect X and gamma rays. It should be worn at the chest level. Suppose if you do interventional work, you can go for headband, you can go for wrist also, nuclear medicine technology, go for wrist also, you can go. Always wear under the lead-apron, not above the lead-apron. And it should be serviced once in 3 months. And anybody receives more than 10 millisieverts in 1 quarter, it is called overexposure. It is not the upper limit. Upper limit is the 20 millisievert, but this is a caution we are taking. When you receive 10 millisievert, something fishy, the situation is not correct. So we have to identify the pros and cons, either machine or the improper training, or it may be mishandled by somebody like that. That's why we call it overexposure 10 millisievert. It's a caution of word. So we should identify and rectify things like that. And then we should do radiation survey, meter right side. You can do periodical radiation survey you have to do during installation, and you have to repeat annually. For example, this is the X-ray room. What you must do is, you take a phantom, or phantom is not available, take a packet, fill with water, Keep instead of patient, switch on the machine, give the maximum kV, normal MA, put the radiation, measure the radiation in and around wherever we are interested. Above the ceiling, below the actually ground, actually inside like that, patient waiting area. Then calculate what is the annual dose. If everything is correct, you can go. Otherwise, you have to make some remedies. Then emblems you have to put. This is the X-ray emblem actually here. This is the X-ray emblem. This is for radioactive material, nuclear medicine and radiotherapy. And this is for transport area. So this should be put, and additionally you can put also local language also, you can put radiation, keep away like that. Apart from that, actually there are some three important terms we use actually is time distance shielding. Always use lesser time. Don't spend much time. Keep larger distance. If you increase the distance 2 times, radiation will reduce by 4 times. Inverse square law we call it. 2 times if you increase the distance, 4 times radiation will come down. Always use actually shield. Without shield, don't go to the something like going to this actually war field. When the soldier goes to the war field, he has to prepare himself, put a lot of metal gadgets like that. So without lead apron, don't expose yourself. There are so many things are there. Actually, this is a thyroid shield. This is a gonad shield. There's a gloves. Everything is available. Pediatric, we should respect them because they are very sensitive, 10 times more they're sensitive than adult. And we should be actually given top priority to actually to reduce the dose. And radiation and pregnancy, very important issue again. So no pregnancy should be actually screened for radiation or treatment without actually listening. So counseling has to be done like that. Then very important questions to be raised. Then whether once pregnant, whether we can allow them to work. Yes, you can allow. Now the policy is, if the radiation level is less than 1 milligray in any area, pregnant woman can work as a radiation worker in the department. Then a question comes, when to do termination of pregnancy? If the radiation dose more than actually 100 millisieverts, then you can ask for actually termination of pregnancy if clinically accepted by the gynecologist. If a less than 100 millisieverts, don't recommend for actually this. If you go through this, all this mission output, no imaging procedure will give you 100 milligray radiation to a patient. That means what? Even accidentally you undergo one CT scan or one X-ray, you can't reach actually 100 milligray radiation. So there are some responsibilities of the employer. The responsibilities are follow regulatory rules. The employer should be aware of what is the regulation. The first talk provided. Provide TLD batch to everybody. And health surveillance you have to do. What is health surveillance? You can see, listen the right side. So every worker on employment, you must put actually health surveillance. What do you mean by at least you take for chest X-ray, complete hemogram, physical examination, countersigned by a physician or something like that. General medical examination and then fitness. Why? Inherently he can have some problem. Already he has some leukemia or already he has some problem inherently. Then he should not actually clubbed with radiation induced damage like that. That's why actually every radiation worker has to be actually screened for health surveillance like this. Now a question comes after listening that people may think that, oh, going to a nuclear technologist, going to be a radiologist is harmful. Then we can go to other actually profession like that. It is not so. You cannot go anywhere because everywhere you have radiation. Even in your kitchen you have radiation. The water you drink you have radiation. We have radon is there in the water, well water. So you cannot escape. So eating the banana, potassium is there. You cannot escape. So if you travel actually 5 hours in an aeroplane to intercontinental, then you will get 25 microsievert radiation. All pilots are receiving. So cosmic rays are actually there. Outer world is pouring radiation. So there is no place in the world actually with zero radiation. So working as a radiologist or radiotherapist or physicist or technologist is not harmful. You are doing some additional service like our army people are doing in the war front. That's all. That means you are proud, you are working for the nation, working for the humanity, offering the service like that. Now this is what you can see. The natural background radiation is 82%. Only 18% is man-made. So the natural source of radiation is very abundant. You can see here, this is the level of actually 3 millisieverts everybody is receiving. Even sitting in our house, we are receiving 3 millisieverts. And if you take chest X-ray, you are telling 0.1 millisieverts. One CT scan gives only 10 millisieverts. 3 years background radiation equal to one CT scan. So you should not actually this alarm about the radiation, and always see, if you see that last 0.3 fatality rate per 10,000. If you compare the industries of trade, manufacture, government, transport, agriculture, you can see the mining is actually 6 in 10,000 and construction is 3.9, radiation industry is 0.3. Still all these things, if you adhere the safety, our fatality rate in 10,000 people is less than 1, still we are a safer industry. So in summary, what we want to highlight is radiation is actually a risk versus benefit tool. So actually we should be very careful, it should be justified, its use, it should be optimized, its examinations. We should be actually concerned about actually always fluoroscopy and CT scan, and pediatric and pregnancy we should respect, and every hospital should have a radiation safety committee with a radiation safety officer, the people using the radiation like this. So in general, what I want to conclude is radiation safety is like actually a butterfly. If you tighten it, it will be killed. If you lose it, it will fly. So you have to actually say delicate material. So in between you have to optimize. Actually, if you tighten the radiation safety, you cannot perform any examination in the hospital. You have to stop the work, you close the hospital. If you lose it, actually everybody get exposed. So in between, actually you have to manage. Thank you very much.